Hello, I am Elizabeth Kazanchian, and today I'm going to talk about a cardiovascular disease called myocardial infarction, also known as a heart attack. I'll be talking about what myocardial infarction is, what the symptoms are, what causes it, who gets affected by this disease, and what treatments there are to treat it. What is myocardial infarction? So this is the interruption to the regular pattern of the blood flow in the body. This interruption occurs when cholesterol, calcium, or plaque builds up in the cardiac arteries, creating blockage, which you'll see in the lower left image right here. This is the artery, and this is all the buildup. And this is the narrowing of the arteries, and this results in a lack of blood flow to the heart. As the amount of blood flowing back to the heart decreases, cardiac tissue becomes to die down due to the lack of oxygen and vital nutrients. So it'll be hard passing through this artery, going to getting the necessary nutrients needed in this area. The loss of cardiac tissue is irreversible and extremely threatening to human life. If the buildup in the arteries worsens, a blood clot can form which completely blocks the flow of the blood. This will send the patient into cardiac arrest or heart attack immediately. As the cardiac tissue is deprived of oxygen, the patient's heart rate will begin to slow down. Thereafter, the individual blood pressure will increase as the heart tries to prevent and repair the damage. This is occurring as a result of myocardial infarction. In this case, cardiac ischemia will lead to scarring in the heart, and it will not permit the heart to contract normally. So in these pictures, it indicates that this is a normal heart and its artery wall, which the blood is passing through very normally and giving it very clean oxygen. And to the picture to the upper left, you can see that there's a blockage and there's a clot, unfortunately unable to get through the artery. And in this black spot, you can see that there is dying muscle since no air is getting to it. What are the symptoms of myocardial infarction? And the biggest indicator is chest pains. In this case, it sends shooting pain through the chest, and it is highly recommended to seek immediate and emergency treatment when experiencing this chest pain with alongside with fast heartbeat. Other symptoms include increase or decrease in both the heart rate and the blood pressure. So over here, usually this is higher than 180 systolic and higher than 120 diastolic is a huge indicator of having a heart attack. Another symptom is cold sweats, shortness of breath, nausea, and fatigue. What causes myocardial infarction? And that is individuals who struggle with smoking, doing substance abuse, stress, poor diet, and a sedentary lifestyle, which means that they are mostly seated. These factors are large seen in low-income communities and populations because of the lack of health education and misconceptions that healthy food and lifestyle comes with a hefty price tag, contributing to these bad habits. Also, many people can't afford the health care that's needed to catch the symptoms early of a heart disease. And the people who mostly get affected are people who are suffering from high levels of stress due to various social and financial obstacles they are faced with. Many southern states such as Alabama, Arkansas, and Louisiana suffer from the worst mortality rates from myocardial infarction, as seen in the picture in the lower right. Usually the southern states are affected with heart disease, and that is mainly due to their lifestyle and their food because they eat a lot of fried foods. Also, another indicator is that men suffer twice as more likely than women to suffer from a heart attack. And people who have high blood pressure also are a big indicator of people who have myocardial infarctions. China, a country who has a significantly influential tobacco industry, also suffers high rates of mortality due to heart attacks, and not many studies have shown as to why. There are different types of treatments that can help myocardial infarctions once received. According to the American Heart Association, treatments such as medications or coronary artery bypass, when they go in with the via surgery and take out the blockage, or via stent in the coronary artery, they go in with a laser stent in your artery and try to open up the blockage of the veins, of the arteries, I'm sorry. And they put in a catheter sometimes. And there's also cardiac rehabilitation, which you seek medical therapy, but you adapt the healthy diet, you get regular exercise, reduce stress, and most importantly, stop smoking if you are a heavy smoker. And this is about myocardial infarctions. Please take care of yourself because they are your heart is your most important organ that you can take care of for a better and healthier life. Thank you.